Chikungunya outbreak in southern China. What you need to know. #Understanding Chikungunya. The current outbreak in southern China. In recent weeks, southern China has witnessed a significant surge in cases of chikungunya, a mosquito-borne virus that has affected thousands. This outbreak is being recognized as one of the most significant since the disease was first identified in the country nearly 20 years ago. As of now, over 7,000 individuals have been reported infected in Foshan, a city in southern China, with additional sporadic cases emerging in nearby cities and municipalities within Guangdong province. The situation has escalated to such an extent that a vice premier visited the most impacted district last week, emphasizing the need to control imported cases and prevent the further spread of chikungunya both locally and beyond. This alarming rise in infections has also led the U.S. Centers for Disease Control and Prevention, CDC, to issue a travel advisory to warn potential visitors about the risks associated with this outbreak. Local authorities are actively engaged in efforts to halt the spread of chikungunya, employing both traditional epidemic control measures and innovative strategies aimed at reducing the mosquito population responsible for transmitting the virus. What exactly is chikungunya? Chikungunya is an illness caused by a virus that shares its name. According to the World Health Organization, WHO, this virus is primarily spread to humans through the bites of infected female mosquitoes, particularly the Aedes aegypti and Aedes albopictus species. These mosquitoes are notorious for also transmitting other serious diseases, such as dengue and Zika. Typically, symptoms of chikungunya manifest between 4 to 8 days after a person is bitten by an infected mosquito. Common symptoms include fever, fatigue, and nausea. However, the hallmark of chikungunya is the severe joint pain that can persist for months or even years. The term chikungunya originates from a word in the Kimakonde language of southern Tanzania, where the disease was first identified in 1952, meaning that which bends up, reflecting the stoop posture of those afflicted due to pain. Dr. Pilar Ramon Pardo, an advisor in clinical management for the Pan American Health Organization /WHO, poignantly described the suffering of patients, stating, "People cannot move because it's so painful. There are tears in their eyes." Importantly, chikungunya is not transmitted from person to person and is rarely fatal. A study published in Nature estimated that approximately 35.3 million people are infected annually across 180 countries, with only about 3,700 deaths reported, which is a mere 0.01% of cases. The WHO indicates that infants and the elderly are at a higher risk of experiencing severe forms of the disease. Currently, there is no cure for chikungunya. Treatment focuses on alleviating symptoms. The frequency of chikungunya outbreaks. Following its emergence in Tanzania, chikungunya has been detected in various countries across Africa and Asia. Notable urban outbreaks occurred in Thailand in 1967 and in India during the 1970s. A significant outbreak in 2004 began in East Africa, particularly on Kenya's Lamu Island, where it infected about 70% of the population. This outbreak subsequently spread to neighboring islands like Mauritius and Seychelles. In 2006, India experienced a widespread chikungunya outbreak with nearly 1.3 million suspected cases, primarily in the Karnataka and Maharashtra provinces. That same year, Sri Lanka also faced an outbreak, and subsequent years saw similar incidents in Southeast Asian nations such as Singapore and Thailand, affecting thousands. As of May 4th, over 47,500 chikungunya cases have been reported in the French island territory of La Réunion, with ongoing high transmission rates since the outbreak began last year. In the United States, the first locally acquired cases were documented in Florida, Texas, Puerto Rico, and the U.S. Virgin Islands in 2014. By 2015, chikungunya was classified as a nationally notifiable condition. The WHO noted in 2016 that while the risk of large-scale outbreaks in the U.S. was considered low, local transmission cycles could not be entirely dismissed. From 2010 to 2019, China reported imported cases of chikungunya, including clusters in Dongguan, Guangdong in 2010, and Ruili, Yunnan in 2019. Assessing the current situation in China. The first known symptomatic case in the current chikungunya outbreak in China was recorded on June 16, according to the Chinese Center for Disease Control and Prevention. The majority of cases are concentrated in the Shunde district of Foshan, a city with a population of 9 million. From July 27 to August 2, approximately 2,892 new local cases were reported, with 95% of these occurring in Foshan. The remaining cases were distributed across other cities and municipalities in the region, including Guangzhou, Shenzhen, Dongguan, and Zhongshan. On August 4, Hong Kong reported its first imported case of chikungunya, highlighting the outbreak's reach. The Chinese CDC has linked the 2025 outbreak to imported cases, with Liu Xiong, a chief expert in vector-borne disease control, stating that the global spread of the virus has led to inevitable imported cases in China. He noted that the presence of local transmission vectors, particularly Aedes mosquitoes, has facilitated ongoing local transmission cycles, resulting in concentrated outbreaks in affected areas. However, specific details regarding the initial imported case that triggered the outbreak have not been disclosed by Chinese authorities. Kang Min, director of the Guangdong Provincial Center for Disease Control and Prevention, cautioned that the current flood and typhoon season has exacerbated mosquito activity, complicating efforts to control the disease. In response to the outbreak, Chinese authorities are implementing strategies reminiscent of their COVID-19 response, including mass testing, isolating infected individuals, and disinfecting entire neighborhoods. How to protect yourself from chikungunya. While a vaccine for chikungunya exists, it is not yet available to the public in China. The National Health Commission of China emphasizes that preventive measures, such as promptly eliminating mosquito breeding sites and reducing mosquito populations, are crucial for preventing infection. Effective methods include using mosquito coils, repellents, and nets to deter, kill, and prevent mosquitoes. In the United States, the CDC reports that 2 vaccines for chikungunya are available, and it is recommended that travelers to high-risk areas get vaccinated. Pregnant women are advised to reconsider travel plans and should delay vaccination until after giving birth. Conclusion: chikungunya is a serious public health concern, especially in light of the current outbreak in southern China. As the situation develops, it raises important questions about disease prevention and control. How can communities better prepare for such outbreaks in the future? What role do individuals play in protecting themselves and their families? Share your thoughts in the comments below. China battles chikungunya outbreak. 7,000 cases reported. Mosquito-borne virus explained. A mosquito-borne menace, chikungunya virus surges in China. Just when you thought the world couldn't handle another viral outbreak, along comes chikungunya. Over 7,000 cases have been reported in China's Guangdong province since July, sparking health measures reminiscent of the COVID-19 era. Let's delve into what this means for the region and how authorities are responding. Foshan, a bustling city in the south, has been hit the hardest. Patients diagnosed with chikungunya are quarantined in hospitals, their beds swathed in protective mosquito netting. Discharge only occurs once they've tested negative or completed a week-long stay. This virus, transmitted through the bite of an infected mosquito, causes fever and excruciating joint pain, which can linger for years in some cases. Though uncommon in China, outbreaks are frequent in South and Southeast Asia, as well as parts of Africa. The spread, a worrying trend beyond Foshan. At least a dozen other cities in Guangdong have reported infections, with nearly 3,000 new cases surfacing in just the past week. Hong Kong recently confirmed its first case, a 12-year-old boy who fell ill with fever, rash, and joint pain after a trip to Foshan in July. Notably, The virus isn't contagious between humans. It spreads via the bite of an infected mosquito onto a healthy individual. Officials assure that the majority of cases have been mild, with 95% of patients recovering within a week. Nevertheless, the sudden surge has sparked concern among the populace unfamiliar with this virus. "This is frightening. The long-term effects sound agonizing," commented one user on Weibo, China's popular social media platform. In response to the outbreak, the U.S. government has advised travelers to exercise heightened vigilance when visiting China. Decisive action. China's response. Guangdong authorities are taking no chances, vowing to implement stringent measures to halt the disease's spread. Those exhibiting symptoms like fever, joint pain, or rashes are encouraged to seek immediate medical attention for testing. To prevent mosquito breeding grounds, residents are instructed to eliminate standing water from household items like flower pots, coffee makers, and unused bottles. Non-compliance carries hefty fines of up to 10,000 yuan, $1,400. An unconventional strategy involves deploying elephant mosquitoes, capable of consuming smaller virus-carrying insects, alongside armies of mosquito-devouring fish. Last week, Foshan released 5,000 of these fish into urban water bodies. Drones are even being used to identify stagnant water sources. Neighboring cities initially mandated a 14-day home quarantine for travelers from Foshan, but this requirement has since been lifted. Comparisons to the pandemic's restrictive measures have surfaced, with some questioning their necessity. One Weibo user remarked, "It feels eerily familiar, but are such measures truly needed?" Another posed, "What's the rationale behind quarantine? An infected person doesn't transmit the virus by biting others." China's stringent pandemic protocols included enforced quarantines in camps, sealing off entire neighborhoods at short notice for extended periods. Understanding chikungunya. When bitten by an infected mosquito, symptoms typically manifest within 3 to 7 days. Besides fever and joint pain, affected individuals may experience rash, headache, muscle ache, and joint swelling. While most recover within a week, severe cases can suffer lingering joint pain for months or even years. Newborns, the elderly, and those with pre-existing conditions like heart disease or diabetes are at higher risk for severe illness. There is first identified in Tanzania in 1952, chikungunya has since spread to over 110 countries. Prevention focuses on reducing mosquito breeding sites, per the World Health Organization's guidelines.